This program is supported in part by a grant from the Coronavirus Response Fund.
Hi, I'm Dr. Angela Sims. I'm a child psychologist and I direct the Children's Center, the Sarah T. Butler Children's Center for the Pastoral Institute. And I'm going to talk to you today about mental health issues in children and how you can identify those in your child and when and how to seek help. For this segment, we're going to talk about autism and what to look for. And autism is very much on the rise. I think the latest statistic is 1 out of 54 or 52 children are diagnosed with autism. So it is one of the major concerns for children now. And parents are becoming much more educated about what autism is. When, 15 years ago, for example, there were very few children being identified, or some identified, and now in the last 15 years it's become a major focus in terms of identifying concerns in kids. So we get a lot of referrals to our agency, the Pastoral Institute, for autism. And parents seem to be aware of some of the symptoms there because there's been a lot of media attention to autism. So let's talk about what to look for. And one of the things I want to caution is just because your child has a few of these doesn't mean they have autism. And they can have some of the things that are going on, and there might be something else like social anxiety or a speech and language delay that is the primary issue. So that's why an evaluation is critical. So, for example, if your child doesn't have any single words by age 2, that's a concern. You first want to get their hearing checked because that could be why they're not talking. If they're not doing phrase speech by age 3, that's also a concern. Any avoidance of eye contact or poor eye contact can be a concern. Now, I've had parents tell me, my child has good eye contact, they must not have autism. Well, that's not necessarily true. You can have good eye contact and have autism, but it is often the case that that's the opposite, that they don't have good eye contact. If you see abnormal body posturing or facial expressions, so the child gets into kind of a stiff stance, maybe with their arms or shoulders, their face, or they start flapping their hands or their arms, those can be signs of autism. Abnormal tone of voice. Now this would be like your child sounds like a robot. It's monotone. They don't make any change in their inflection in their voice. Behavioral issues can be part of autism, and with behavioral issues that could be across a lot of different problems, but often the difference I see for kids with autism versus just having a behavior disorder is the child with autism will have a behavioral meltdown when they're faced with new situations or transitions or overstimulated, whereas the child who has temper tantrums is doing it because they don't want to do something or they want something, like they throw a temper tantrum in the store because they want this toy. The child with autism might have a meltdown because they can't handle going to the playground because there's too many kids there. Anytime we see deficits in language comprehension, like they're not understanding what we're saying, or they don't know how to do social conversation, like back and forth conversation, then I, again, get concerned there. Again, you want to check hearing first, make sure there's not something going on there, and then you want to get a speech and language evaluation. And then they usually will refer you on for an autism evaluation if that's what they think is going on. I mentioned earlier about abnormal tone of voice, sounding like a robot, but another way that we see with children with autism is they might have their speech sound like everything's a question, where their inflection is off, and that can also be a sign. As I mentioned earlier, one of these alone doesn't make autism. This is a compilation of several symptoms where you would want to go get an evaluation. If you see that your child doesn't have empathy for others, doesn't understand social cues like knowing to hug when you give them a hug, they just sort of stand there woodenly, or they don't know how to back up when you're trying to open the door. If they have an intense focus on a topic and they're always wanting to talk about a particular topic, and things that we hear is anime, Pokemon, trains, cars, specific countries, dinosaurs, outer space, and it's more than what is typical for a child that age. So, you know, you'll be having a conversation about something, and then they'll bring up their specific interest out of context, or they'll start talking about a movie, or they'll start reciting lines from a movie or from a commercial. Those can be signs of autism. Another thing to look for is jargon talk. So this would be like, sounds like language, but it isn't a language. It almost sounds like a foreign language, but it isn't a language. I think that in those situations, children are trying to make language, but they just don't have the ability to put the words with it. When you have children that don't want to engage or play with peers, that they either, younger children, you'll see them actually have a temper tantrum, kind of a meltdown, and whenever other children are brought around. With older kids, they'll just kind of withdraw and go off on their own and not play with other children. If they repeat words or phrases over and over again, and they're kind of, especially if they're odd phrases. Any sleep disturbances that you see can be related to autism, but can be related to a lot of other things going on. So you kind of want to first go get a medical evaluation to see what's going on with that sleep with your pediatrician. And anytime you see self-abusive behaviors, especially with younger children, that can be autism. Now with teenagers, self-abusive behaviors like cutting on yourself and things like that can be part of depression. So again, you need to get some assessment to see what's going on with your child. Treatment for autism has progressed amazingly in the last 2 decades. At one time, when I was in graduate school, we were kind of told that, you know, if you had autism, that was kind of it, and there wasn't a lot of documented research treatment that was effective or covered by insurance, although we knew some of the behavioral interventions worked. A lot of insurance companies did not cover them. Now all the insurance companies, at least in Georgia, cover ABA, which is Applied Behavioral Analysis Therapy, which is very effective for autism. And that would go along with school interventions, speech and language therapy if that is needed, social skills therapy, family counseling, and individual counseling, again, as needed for that child. So you would really be looking at an array of services, and that you start first with getting that evaluation to determine what your child would need. Another piece that you want to look at is the differences between boys and girls with autism and the age of noticing the symptoms. People usually notice the problems with boys much earlier. The percentage of boys to girls is much higher, like 4 to 1. With girls, often they can kind of go by unnoticed, or they might have a few things that are going on, and then when they reach about middle school, late elementary to middle school, that is when parents and teachers start really noticing the problems. So again, if your child, your daughter is kind of playing and doing a lot of things when she's younger, but when she gets to that middle school, she doesn't interact with other girls. She had in the past had been just playing with boys, and now she doesn't interact with girls. She kind of withdraws. She seems more odd in her behaviors or her words or phrases. Then that can be, again, a sign that you've got some autism going on. Many of these children that we diagnose have high-functioning autism, which used to be called Asperger's. We don't use that term anymore, but they can be gifted, they can be very functional in school, but they just have kind of almost like a learning problem in social-emotional development. Other children have more significant autism and have speech and language delays, behavioral issues, some anxiety and things like that. In fact, anxiety is very common with autism. So that can be one of the things that you want to look for to see if that's going on as well.